Thanks very much, Kelly, and I'm delighted to be here on the first of the 16 days of action, and I think we're all looking forward to a wonderful fortnight plus, celebrating some of the success, but also looking at some of the progress that we haven't managed to make over the last, and in my case, it's 40 years that I've been working on the issues relating to violence against women. So I guess I'm here as the oldest person that's probably still involved. It's great to see you all here and to see people from so many different agencies. It is disappointing that there are so few men. And we're still in a point where men are not coming forward to address and champion these issues in the way that we would really like and expect. And I think that's something that needs to happen over the next decade or more. So, violence against women. Kelly said quite a bit about it. It's a global issue. It's recognised by all international organisations now, by most governments, not all, but certainly by the Scottish Government. It comprises a long list of forms. Kelly's gone over those: domestic abuse, commercial sexual exploitation and trafficking, pornography, forced marriage with upskirting. There are a whole range of issues relating to violence against women. And just to give you some statistics, which I'm sure you all know, but I suppose it sets the scene. 29% of UK women have experienced physical or sexual violence by current or former partners since the age of 15. 52% of women murdered in Scotland 2007 to 17 were killed by a partner or ex-partner, and that compares with 6% of men in the same period. In 16-17, police recorded 58,810 incidents of domestic abuse in Scotland. 79 cases there were, the woman was a victim and the man was the perpetrator. 20% of women and 4% of men experienced sexual assault as adults. 28% of cases referred to the NRM, which is the National Referral Mechanism for Human Trafficking, are for sexual exploitation and are female. 20% of women and almost 8% of men have experienced sexual abuse before the age of 18. And what that in reality means is that we have women in the room and men in the room who have experienced male violence, who have suffered at the hands of men during their lifetimes. And I think that's something that we quite often forget when we're talking about these issues. And I remember in the early 90s when Katie, I don't know where Katie is, Katie Cosgrove and I were heavily involved in zero tolerance. We had, at the end of every session that we did to talk about zero tolerance, and we showed the posters and tried to engage with people, there was always a wee queue of women at the end who would hang back, and what they wanted to talk about was their experience of sexual violence or domestic violence. And I think that's something that we really need to remember and really need to think about, that we've all had some kind of experience of that, or our sisters, or our mothers, or our daughters. So it's an issue that is significant and is pervasive. It's experienced in urban and rural settings, young and old, rich and poor, able-bodied, disabled, lesbian, bisexual. I think it's experienced by everyone. But we have had progress in the last 40 years in Scotland. And I think back to, I was a community worker in the 70s and 80s. And at that point, what we were doing was talking, it was at the beginning of work with girls, work with women, and trying to engage on a community level. Because a lot of the community development that had been done previously was done with men, unemployed men, poor men, etc. But this was really looking at a slightly different approach, well, a very different approach. And what I found then was an issue that was always raised was violence against women. Tended to be domestic violence rather than rape or sexual assault. But none of the agencies that I worked with saw it as an issue that was relevant to them. It wasn't a social work. It wasn't an issue for social work in those days. It wasn't an issue for the police unless they were called to an incident. And what they tended to do at that point, and a lot of the police officers that I worked with were very angry about the response that they had to have. They would remove the man from the house. They would quite often take him, if they didn't think they could charge him, they would take him a couple of miles away, so they had to walk back to the house. And the hope was that by the time they get back to the house, he would be less angry and less likely to be involved in more domestic abuse. Now, we know that that's not the way things work at all. It wasn't an issue for schools. It wasn't talked about in schools. It wasn't an issue really for any of the statutory agencies. The only people that were talking about it were Women's Aid and Rape Crisis. And I think we've been very lucky in Scotland to have a very vibrant and strong voluntary sector. But it was they were the ones that were knowledgeable about the issue and were able to provide some kind of support. And at that time, at the end of the 80s, I became Women's Officer for Strathclyde Regional Council. And I remember back to those days, there were 26 departments at that point in Strathclyde Region. It was the biggest local authority in Western Europe, covered half the population of Scotland. There were 26 departments, including fire and rescue, including police. They were all part of Strathclyde Region. And out of those 26 departments, there was not one woman head. So there were no women directors. There were no women deputy directors. And I think there was one woman assistant director. At that point in the secondary schools, there were no women secondary heads. And that has a huge impact on any institution. So imagine me going along as a former community worker to say to directors, right, give me your women's equality plan now. To which they all said, we've no idea what that would be. And sadly, we're still looking at a situation today where we're talking about a gendered approach to substance misuse, which we're talking about in Dundee at the moment. And people are saying, what would be a gendered approach? What would be the difference? And that's one of the things that we've got to turn around. In the 90s, as I say, we established zero tolerance was almost across the whole of Scotland. There were a few local authorities that didn't buy into it. But it was very important because it was about public education, challenging opinions, busting myths, really putting information out into the community so that people were challenged about their views, that it was normal, that it was a domestic matter, that it was a private matter, that it would always happen. The inevitability is something that we face still today. And again, people were angry when we put those posters into offices, and we had reports of posters being ripped down off walls. We had schools refusing to put the posters up. That was the climate in the 90s. And police would be saying, this has got nothing to do with us. Nothing to do with us. Social work, the same. Now, that's not to say that there weren't fantastic individuals within those departments who really made a difference, but it certainly wasn't an institutional approach. In the late 90s, Scottish Parliament obviously was established, and they prioritised first domestic abuse and then violence against women much more generally. And I think that's been really key to the success of the progress that we've made in Scotland, the fact that there's been national political leadership. And a lot of that came from, I think, the elected members who went to the Scottish Parliament from the local authorities that had been very active within zero tolerance and fighting violence against women. So that has proved very successful. The establishment of violence against women partnerships has signalled a multi-agency approach is required. The introduction of Safe and Together, the rollout of MARAC, all of these things have been really important. New legislation on forced marriage, on stalking and harassment, etc., etc. So what else needs to happen? And I thought I would say what I think a public health approach is, and I stand to be corrected if this isn't right. But it's a strategic, coordinated and long-term approach involving a full range of statutory and voluntary agencies in a multi-agency setting. It involves a true partnership approach where people buy into that. It addresses the causes and doesn't merely respond to individual incidents and or cases. So, for me, it means high-level support and scrutiny from all agencies. I expect in Dundee that the chief, and I know that the chief executive is on board and supports the work. I know that the chief social work officer supports the work. I know that the chief executive of the NHS supports the work. And that is really important. I'm not saying that always means that we get what we want, but I think it gives a profile and I think it gives a level of championship that is needed. There needs to be a commitment to a multi-agency approach. And we've got all these partnerships in Scotland. I've attended 2 or 3, including Dundee, which I've obviously done on a regular basis over the last 3 years. And there is still a level of people sending representatives who come along and you're not quite sure who they're representing or how they go back to their organisation to see what needs to happen next. So I think that is still a challenge for us. We need to have people round the table who represent their organisations and who feed back to their organisations. And where I see that happening is with the women's voluntary sector. Every time we have a meeting of the partnership, they're the ones that fully engage. We're making progress. I think there has been progress made in Dundee, but it is an issue, I think, for all partnerships that we need full participation. We need high-quality support for women and children. We need earliest intervention to reduce risk. One of the priorities in Dundee is to upskill mainstream staff in statutory sectors to improve their understanding of and their response to violence against women. We've now got a small consortium of the third sector who are developing and are going to be rolling out a programme of training with the help of the universities. And I think that's about capacity building, and we're very much welcome the involvement and commitment of the women's sector. I'm pleased to see Mary here today from Women's Aid. We need effective protection measures from the court, CJS. I think that's still a real weakness. That child contact is a problem. There are a whole range of issues to do with protection that are still not addressed. We need good, strong legislation. And I have to, some of you in the room would be disappointed if I didn't raise this. We still have legislation that is allowing us to regulate and license adult entertainment, where we know that women are being groomed for sexual exploitation, if not sexually exploited within those premises. That, in the 21st century, and with an equally safe, which sees commercial sexual exploitation, adult entertainment, pornography as being forms of violence against women, is not acceptable. We've got a legislation which does not criminalise the punters that are exploiting women on a day-to-day basis. Those who are being criminalised are the women who are forced to sell sex or are selling sex because of their vulnerability. That should not be the case. We need primary prevention work, particularly with young people. We cannot have a situation where young men think it is reasonable to rape women or to go to strip clubs or to buy women in prostitution. That needs to change. And I'm very positive that it will change. I think in Sweden, where they've had legislation on criminalising the punters who buy sex, one of the things that they've seen is not a huge number of men criminalised for buying sex. They've seen a reduction in the number of men buying sex, and they've seen a change in public opinion, particularly around young people, young men thinking it is unacceptable to buy and sell women. We need to challenge the inevitability of boys being boys, of entitlement. And we need to influence public opinion in a long-term and consistent way. We've got very good examples of effective policy and campaigning. Smoking in public. We've got drink driving. There are lots of different examples, but it needs a joined-up approach. It needs a long-term, consistent approach, and everybody to be involved. I'm going to finish by just saying that no single agency can resolve this. Violence against women is endemic. We have a situation where women and girls are still not equal, are still subject to harassment and other forms of male violence. We all need to work together, and it needs effective leadership at a very high level. We need our First Minister, we need our leaders of councils, we need our senior officers to be coming out and speaking out on this issue as they talk about the issue of substance misuse, alcohol misuse, etc. So I'm delighted to be with you, and as I say, on this first day of 16 days, I hope you all are involved in all sorts of activities, and I'm hoping it'll be a good day. Thank you.